Today, we're diving into the watchman procedure. It's a breakthrough approach designed to reduce stroke risk for people with atrial fibrillation. Over the next few slides, we'll explore what it is, how it works, and why it's becoming a game changer in heart health. Let's get started. Let's talk about why this procedure exists. Its main goal is to prevent stroke, especially in people with atrial fibrillation, a common heart rhythm problem. It also helps avoid the need for long-term blood thinners like warfarin, which can be tough to manage. The watchman device itself is a small, umbrella-shaped implant placed in a part of the heart called the left atrial appendage. This is where dangerous clots often form, leading to stroke. The procedure is minimally invasive and offers a new option for those at high risk who can't take blood thinners. Let's break down the watchman procedure in a simple way, easy to remember. It starts with groin access, then the catheter travels to the heart, specifically the left atrial appendage, or LAA. The device is placed there to seal it off. This blocks clots from escaping, reducing stroke risk. The benefits are clear. It's a long-term alternative to blood thinners, involves a short hospital stay, usually just 1 day, and no open heart surgery is needed. Risks include bleeding, device-related clots, fluid around the heart, and very rarely, device displacement. Let's break down the watchman procedure in simple terms. It's all about closing off the left atrial appendage, a small part of the heart where clots often form in patients with atrial fibrillation. By sealing it, we reduce stroke risk without needing lifelong blood thinners. After the procedure, patients usually take blood thinners for about 45 days. Then, follow-up imaging checks the device's position. If all looks good, they might eventually stop anticoagulants altogether. Now let's talk about coding clinics and navigation, the path we follow. These clinics are where we come together to solve problems, share insights, and refine our skills. Navigation isn't just about finding our way through code, it's about guiding each other, making sure no one gets lost. This part of the process keeps us connected and moving forward, step by step, toward our goals. If things don't go as planned, it's important to know what to do next. Failure isn't the end, it's a chance to learn, to adjust, and to try again smarter. We'll look at common reasons why things might not work out and how we can turn those setbacks into opportunities for growth. Because success often comes after a few missteps, let's explore what happens if it's unsuccessful. A brief transitional moment here as we move between sections of the presentation. Let's continue forward to the next topic, which we'll explore in more depth. A brief transitional moment here as we move between sections of the presentation. Let's continue forward to the next topic, which we'll explore in more depth. A brief transitional moment here as we move between sections of the presentation. Let's continue forward to the next topic, which we'll explore in more depth. A brief transitional moment here as we move between sections of the presentation. Let's continue forward to the next topic, which we'll explore in more depth. That brings us to the end. Thank you for joining me today and sharing this time together. I hope you found some ideas to take away and that they spark something new in your own work. Until next time, take care and keep exploring.